Welcome to the podcast series on mainstreaming GBV risk mitigation in humanitarian settings. I am your host, Liloba Paul, UNHCR Learning Development Officer on topics related to gender-based violence. This work is brought to you by the Safe from the Start Project, a collaboration between UNHCR's Division of International Protection and the Global Learning and Development Center in Budapest. Our topic today is nutrition and mainstreaming GBV risk mitigation. It is my pleasure to have with me Millicent Lusigi, Nutrition Officer based in UNHCR Ethiopia's Gambella operation. Welcome, Millicent.
Thank you. It is nice to be part of this podcast series.
Great. And could you share with us a bit about your experience with mainstreaming GBV risk mitigation in your activities as a nutrition officer?
Yes. After attending the GBV mainstreaming workshop in Addis, Ethiopia in 2018 December, I arrived in Gambella and sought audience with the head of sub-office to pass on the information and guide the sector leads to advocate for GBV mainstreaming agenda for the partners and at the interagency forum the same month. I was able to orient and provide sector leads with guidance and advocate for inclusion of GBV mainstreaming for the 2020 planning for sectors. In nutrition sector, in liaison with the nutrition partners, we were able to underscore the importance of GBV prevention and risk mitigation measures. I prioritize review and inclusion of the risks in the proposals for both operational and implementing partners, given the sensitivities of the work we do in nutrition of contact with vulnerable groups.
Yes, that means your focus is nutrition sector, but you also made sure to connect with senior management in your sub-office, considering that mainstreaming GBV risk mitigation also requires coordination across sectors. Thank you. And thanks for talking about the different types of work with partners. What were some of the challenges you faced?
The main challenge that I faced at the outset was with sectors' ownership of the guidance I provided based on the National Action Plan for GBV mainstreaming. However, with support of the senior management team and the hiring of a GBV focal person and training being conducted for sectors and partners by the media of implementation, sectors and partners were able to clearly understand and augment GBV mainstreaming in the work they do. Program sector also included for the first time GBV monitoring in the media and the India joint evaluation.
I see. Time was needed to also make sure roles and responsibilities of technical sector and program were clear, along with the continued support role of the GBV focal point. Do you have an example of a promising practice you carried out?
Yes, I would point out to coordination and information sharing. As mentioned, the National Action Plan implementation began. With other sector leads, we were able to advocate for GBV mainstreaming agenda for the partners at the interagency forum and highlighted the importance of GBV mainstreaming, signing of code of conduct by partners, and incentive workforce, which has been taken up as a core priority in accountabilities, and partners have reported signing of code of conduct. Particularly in the nutrition sectors, partners included the GBV mainstreaming activities with clear deliverables in the PPAs and other proposals from other donors, which I reviewed given the sensitivities of the work we do. There was capacity building through senior managers' support and commitment. GBV mainstreaming has been followed up quarterly at all levels, and by mid-year review, there was evaluation of where we were with GBV mainstreaming. I requested program and the operation to include GBV mainstreaming status check for partners during the presentation and camp-by-camp review of programs. This process highlighted the gaps which were picked up, documented, and follow-up actions instituted. One of the actions entailed the organization of the GBV mainstreaming workshop refresher, which was conducted in August of 2019 by the GBV focal person, where partners and sector leads were able to report on status of implementation of the National Action Plan and set new targets for implementation of the processes. In summary, commitment by the trainees to follow through the implementation coupled by the senior management support is what has enabled the scale-up of GBV mainstreaming in Gambella camps, Ethiopia.
Thank you. codes of conduct, PPAs, capacity building. It sounds like this is already quite a series of activities, together with evaluation of mid-year, camp by camp review of programs for GBV risks. And also the support of senior management seems to be an essential element.
Yes, there was yet another innovation of father-to-father support groups in Gambella camps informed by the nutritional causal analysis, which enabled scale-up in 2020 in some of the camps with the aim to augment sharing of roles amongst fathers and mothers in a household and improve child caring practices with a lens on reducing GBV. Gambella operation has over 30 father-to-father support groups and plans to have an expansion in 2021 through development of a systemic curricula.
Thank you very much. And what are some suggestions or advice that you would want to share with other members of the nutrition workforce?
It is important to be deliberate as a nutrition officer to include GBV agenda during nutrition assessment. The standardized expanded nutrition survey and the nutritional causal analysis offers a very good platform to be able to underscore the GBV risks in nutrition implementation of different core activities. This information can also be translated with the annual age gender diversity mainstreaming process and progress data to denote action. Planning and strategic workshops where partners present and discuss on how they have been able to mainstream GBV enables experience sharing and adoption of practical context strategies in implementation of nutrition program. Regular monitoring and reporting on GBV indicators in nutrition programs allows for in-depth consultation with GBV specialists to improve on actions or change direction in prevention and mitigation of the risks.
Thank you. And thank you for pointing out the different parts of the operations management cycle. I heard you speak of different stages, the assessment stage, planning, also implementation, monitoring, reporting. What are some resources or technical guidance you would recommend to other nutrition personnel, maybe other health personnel, that you find useful for mainstreaming GBV risk mitigation into the nutrition sector?
Certainly, the ISAC GBV guidelines offer a wealth of resources with clear guidance on inputs, outputs, outcomes that will guide the nutrition sector in determining what are the risks that they would like to mitigate. UNHCR has worked together with Save the Children International, and there is an excellent document on the infant and young child feeding framework, which offers a platform and an opportunity to remember how to relate with sectors, which results in the mitigation of risks.
Thank you very much, Millicent, for your time with us and for sharing your experiences with mainstreaming GBV risk mitigation and for recommending some resources in the area of nutrition.
You're welcome. It was nice being here, and thank you for providing me with this opportunity.
Yes, thank you for joining us. And also to all of our listeners, do tune in to the next podcast in our series from the GLDC on mainstreaming GBV risk mitigation in humanitarian settings.